Can you discuss Lumineer versus veneer versus crown?
That's a great question. Let's talk about Lumineers. Lumineers is basically, we're not removing any tooth structure from your enamel. We're using your existing teeth, and basically we're adding a layer of porcelain on it. When you do that, you have to keep in mind that when we add even 0.3 millimeters, and that's about the amount of porcelain that's needed to be added to your tooth. You might not seem that 0.3 millimeter is a lot, but when it's added to your tooth, it's going to look a little bulky. So it depends on your expectation. On the other hand, Lumineers, it's great because it doesn't need any anesthesia, and we're using your own natural teeth and just adding it on. Depends on how picky you are. If you do not like bulky teeth, I don't recommend Lumineers. However, Lumineers can be great, okay, for certain other areas. Let's say you have black space, okay, between your cheeks and your teeth. That means that you have a very narrow arch. In that case, Lumineers can help you tremendously because we need to actually bulk up those areas. So that's a great plus. As far as Lumineers, okay, or no prep veneers, it used to be done only with Denmat company, which quote unquote Lumineers are come, but nowadays dentists use no prep veneers. That means the same thing, except now we use different materials. And then, as a matter of fact, okay, we can use different materials which is much harder than our traditional porcelain or Serenade porcelain. Now let's go to veneers. Veneers, okay, is a type of a restoration where the dentist or the cosmetic dentist takes away about 0.5 millimeter to 1 millimeter off the teeth. That amount that's removed from your tooth structure is going to be substituted by porcelain. The great advantage of that is that we can go ahead, and if the teeth are maybe misaligned a little bit, make them to a perfect smile. The other great advantage of that is that it's not going to look bulky. Veneers are very, very technique sensitive, and they give you great results, okay? Veneers needs to be checked, okay, as far as the bite of the patient involved. Now, as I was discussing Lumineers and veneers, Lumineers, if you have a tight bite, okay, or if your teeth on the lower are short, you can just add Lumineers. With veneers, you can, okay, and it will involve extra other steps, such as not doing few teeth, but you have to go back and do most of the teeth in order to elongate the lower teeth. Upper teeth, different story, because upper teeth is usually for cosmetics reason, and then the lower teeth is usually have to do with the function. Now let's go to crowns. Crowns is usually done for teeth that are compromised already. It could be because the tooth had a crack. It could be that it had a large filling and it's failing. So that's the time when we use crown. Crown, we basically remove tooth structure over the circumference of the tooth. So it's like 360 degrees removal of tooth structure, and a cap or a porcelain crown or a dental crown comes on top of your tooth to protect your tooth. There are indications for that. Now, thinking about all those, the least invasive one is Lumineers, but again, depends on the patient expectation. By the way, if you're doing Lumineers and you have a very dark colored tooth, okay, don't expect with Lumineers that you're gonna have a bleach color white tooth. Again, expectation is a big factor. You gotta check your bite, okay? The good part about Lumineers, the pros is that it's the least invasive procedure. That's great. I love that, okay? But if the patient feels that when something goes on their teeth, it's bulky and they're not going to like it, that's not going to work. That's why it's very important, okay, you come into the office, we will check your bite, number one, we check the alignment of each teeth, okay, and then we go from there. You might need Lumineer, you might need veneers, you might need crowns, okay. The crowns, as I said, is the most, I would not say radical, but it's a necessary procedure where we go 360 degrees to protect your tooth. From the best of both worlds of Lumineer and crowns, I tend to go with veneers if I can do any way possible, because when you get a veneer done, you can always go to a crown. But if you have a crown done, you can never go back to a veneer.